Welcome back. Folks with early onset Alzheimer's now able to think about life with delayed symptoms. Last week, the FDA approved the first drug in about 20 years to treat the underlying cause of the disease.
Megan Western tells us a little more about the new medicine and why it's giving one Central Georgia woman hope.
In 2016, Arthena Caston started to notice a change.
I think the day that I went to work and left my car running in the parking lot the whole day, I knew something was definitely wrong.
She was diagnosed with mild cognitive impairment. It runs in her family. Caston says the diagnosis was hard to hear.
And they say to you, there's nothing I can do for you. Go home and get your house in order. I'm now giving you a timeline of death.
Now she hopes to try the new FDA-approved drug that slows down the cognitive decline and buy herself a little more time on the timeline.
It was hope. It gave me a lot of hope.
Caston says this is more time to spend with her family.
It's not a definite cure, but just to know that I have 4 grandchildren now. One is just 2 months old, that they may know that they're Ia, because that's what they call me.
Kat Colcom says this could be the reality for the nearly 150,000 Georgians who have the fatal disease.
As this becomes more available and as our other drugs in the pipeline also show these encouraging results, it's a really great time in our field.
The drug can help folks with early onset Alzheimer's, not advanced stages. That's why she says timing is important.
So if you've noticed some changes in someone's thinking or problem solving or behavior and you haven't addressed those with your primary care provider, it is so important to act early.
She says your primary care physician will refer you to a neurologist who can prescribe the medication.
Time is so essential to us. It means everything.
In Macon, Megan Western, 13 WMAZ News.
The Centers for Medicare and Medicaid Services said it will expand coverage of the drug, broadening access for 1 million people with early stages. The drug will be covered under Medicare, but patients could still have some out-of-pocket costs.
Right now, Leqembi costs $26,000 annually before insurance. The FDA's full approval will provide expanded government coverage. We're breaking down some tips for caregivers when it comes to Alzheimer's disease and the heart. The Alzheimer's Association says wandering is a common behavior for patients, but it becomes potentially dangerous with hot temperatures. Heat stroke symptoms can develop in minutes. Make sure you monitor fluid intake and be aware of heat stroke warning signs like excessive sweating, exhaustion, dry or red skin, rapid pulse, and dizziness.
If someone with dementia wants to go outside, you can reduce the chances of wandering off by creating walking paths around the home, creating engaging activities, or coming up with other small tasks. It's important to keep a recent photo and medical information on hand, and also places where the patient currently goes, like maybe a grocery store, a rec center, someone else's house.
All of that can be shared with first responders to help with rescue efforts if a person wanders off.